Glad to have you back on this segment of Engendered on Captain Television. And like I always say, if you're just joining us, you're right in time because the show is just about to begin. And today we're going to be having, remember that Engendered is the show where we analyze all issues that affect the female gender. And anything that affects children also affects the female gender. So we're going to be looking at something that affects the children too. And today we're going to be discussing understanding learning difficulties in children. We've been in situations where, personally, I've seen children that you try to teach them, they're not understanding. Their understanding level is really backward or slow compared to some other children. And the Nigerian factor, the next thing you will resort to is cane. You start flogging them. Some parents say they are possessed. You start taking them for deliverance and stuff like that. Forgetting that sometimes there might be a problem with them, maybe mentally, or they have to see a therapist. We don't value therapists in Nigeria. Or they have to go through a process, counseling and stuff like that. So actually there's something called learning difficulty. And it happens, we can start noticing it from children, even from their tender age. And we're going to be doing this today with an education consultant. She has done a lot of work, like literally her life is around children, around mentorship. She's involved in humanitarian activities. And her name is Irene Uba. You're welcome to the show.
Welcome to the show, ma'am.
Thank you. It's a pleasure to be here.
You're welcome to the show. So, how are you doing? We've not seen you like in a long while.
Yeah,
so what have you been up to?
Working now.
I always see you're always up to one thing or the other.
Sis, you have to survive. So I've been doing both the consulting on education, NGO and all. So we have to move on.
Definitely. Yeah. Okay, now let's look at this topic we're talking about, learning difficulty. Now, before the show, you were telling us that you're a teacher and you want to lay down the foundation for us.
Yeah.
So let's start from learning. What exactly is learning?
Okay, you see, like I was telling you before, you see, learning, people think learning is as easy as you pronounce it. You know, just the fact that you have sent a child to school, you know, you just assume, I'm taking them to school, she's going to learn. But you see, we haven't understood that we need to even understand that we need to learn to learn. You need to understand how to learn. You need to understand what is learning. You need to understand the components that makes up learning. Okay. You know, so when people bandy the words that, oh, my child has gone to school, or you hear even people say, my child was taught, and I asked them, did your child learn? Because teaching has never been equal to learning. Yeah, it has never been. So what is really learning? Learning is that ability for you to process information, be able to process information given to you, understand it, be able to retrieve it, and also transfer it. So it's complex in the sense that if I have learned something, I should be able to understand what I have learned. I should be able to process it. I should be able to also retrieve it or recall. Because if I've learned to lace my shoe now, tomorrow I should be able to lace my shoe again, recalling it. If I've been able to, I should be able to transfer that skill. If I've learned to lace my shoe, I should be able to transfer that skill into probably lacing my bag or something. So learning has to be such that I have understood what you taught me. I can process it. I can retrieve it. I can recall it. And I can transfer. And the problem we have with the kind of education, the system we operate in, is such that people sometimes they can understand, sometimes they can even process in their mind, but a lot of times, sometimes they can even recall, but a lot of times they can't transfer knowledge. Okay. So it's a defective learning. I mean, you're looking at me like, okay, let me give you an example. Someone goes to the university and learns how to, a computer scientist, for instance. Now, he graduates and comes out, and then his computer has problem. He has to take it to a roadside computer guy to repair it. Can I ask you, is that knowledge a transferable knowledge? He learns, but he can't transfer it. I see people who study automobile engineering in Nigeria still carry their cars to roadside mechanic to fix for them. So it's a defective learning. And it means that we are not getting learning right. Because there are ways people learn. And there are methodology to learning. And these are all the things I think we should unpack so that we can now understand where there is difficulty. Because sometimes what we call difficulty in learning is not really difficulty in learning. It's the fact that whoever it is that is teaching might not be using the right methodology, might not have the right philosophy to teaching, and then they term it difficulty. For instance, when you started the intro, you say you see some mothers, and I see them, they have cane by the side, and this child is learning. I don't understand that kind of learning. Because is it that the child is afraid between the devil and the deep blue sea? Whether my mom will flog me or I just have to learn this thing or cram it or whatever. You know, so it's a defective system. So we need to unpack what are those things. It might be methodology. It might be that the mother doesn't understand the child's learning style. Then everything is generalized as learning difficulty. Yes, there are learning difficulty, and we're going to talk about it, especially the most common form of learning difficulties.
And now, as I was making my research, I saw learning disability, and as well, I saw learning difficulty. Can you expatiate on this?
Okay. Learning disability is actually difficulties that children encounter in learning. So it could be learning disorder. It's just nomenclature. It could be learning disorder. It could be called learning disability or difficulty in learning. That is just, it's just a nomenclature.
Okay, now you mentioned the fact that learning has there are methods to learning, and there are some people are not using the right approach to learn. So can you just give us a brief knowledge about this? What are those right methodology that we should use for learning? Okay,
first we need to understand how do children learn, because we're concentrating on children. How do children learn? You know, one of the biggest names in this will tell you Vygotsky that children learn by doing. Piaget says children learn by doing things. So if I'm coming, I'm going to teach you flour. This is flour here. And I want to say, okay, what are the colors of this flour? Is this flour hard, soft? The right learning for children would be that you feel it, you touch it. You want to look at it, you want in and out to understand it. However, what we see happen is you go to the classroom. What is flour? A flour is this, you cram it. You're not feeling, you're not touching. Now, you can cascade and scaffold learning. I help you to understand it. I build on your knowledge, on your existing knowledge, and I'm building upon it. And then again, we need to also understand that in the class, there are different children. And the way they are different, so are their styles different.
Exactly.
So the way you will construct meaning to knowledge or to an information will be different from the way Chidinma may construct the same lesson. So they are all diverse. So for instance, I am basically more of a verbal learner. You speak, I will understand. Even if there is nothing to show me, I understand. In fact, I can be in a dark room and you're talking on the radio and I will understand, I will write exam and I will pass. That is me. But another child needs to see to learn. That child likes to see, you know, visual learners. Another child has to do with hands, kinesthetic learner. The child must touch, must, you know, and construct things for the child to learn. Another one could also be interpersonal. Just wants to, you explain, the child will sit on his own and then get the knowledge from inside out. Then there are social learners, they want to sit with other people. So you group them in a class. Because you know the diverse learner, you do what we call differentiated instruction. Yes, it might be a bit difficult, but because you want to get all the so at some point in your learning, take numbers, you are 20 in the class, 1 to 4, 1 to 4, or 1 to 5, you have them in group. Okay, discuss in your group, what is air? What is water? You see that the one that is a social learner will even understand better. And I asked adults, when we were in the university, some students understood just from the classes we had. It wasn't from what lecturer said. I had a classmate, Grace. It was whenever we had these extra classes on our own. She said, oh, is that what doctor this person was saying? I didn't even understand that was what he meant. Because she's a social learner. She only understood when we came as a group to study. And she got the highest in group works most times. You know, so these are the dimensions to learning that parents must understand, teachers must understand, for them to now, it is when you have done all, like Bible say, done all and stand. That's when you now say, okay, maybe this child has difficulty in learning. But if you have not understood this person's learning style, your teaching methodology is not right, you don't even understand how children learn, you cannot just come out and say, this child has difficulty in learning.
No, back to our topic for today. What are those difficulties?
Okay. Difficulty in learning, there are major ones because there are a lot of them, but there are major ones. Dyslexia is a difficulty in learning. It's a learning disability. It's a learning disability that's got to do with reading. You know, it's comprehension. The child wouldn't be able to comprehend words, would see words in the reverse, like P is supposed to face this way. You see the child is seeing this way. You know, so you say the child is dyslexic because, but it's not also, before we even get to difficulties, naming all of them, the ones we can, you can't label a child to have learning disability until you have taken that child for assessment by a professional. Yeah, because you can see the traits, like us educators. I tell educators, it's not in your power to declare someone dyslexic, dyslexia, dyslexic. It's not in your power. What you're to do, and the knowledge you should have, is what are the traits of a dyslexic child? What are the traits of a dyslexia child? So that you can now tell management, oh, from my experience in teaching this child in the class, I've noticed that this child sees letters this way, and so when he writes this way. I've noticed that this child is finding it difficult to comprehend or finding it difficult to write. You know, so the parents can now be invited and then spoken to, and then the parents, so it's not even in their own power to declare that. What they do is to take the child for comprehensive assessments by professionals, and if the professional say, okay, after looking at this, I think this child has a spectrum of this and that, and this is what you should do. So dyslexia, one of the most common one in the classroom.
Yeah,
a child cannot comprehend. Reading is difficult. You know, the child sees
5 like S.
Yes, like S.
It's upside down.
Exactly. You know, turns the in the reverse. There's dysgraphia. Dysgraphia is inability to write well. So the child finds it difficult to write. The handwriting is messy. The child cannot, in fact, to copy text from the board is difficult. Copy text from the textbook is difficult. So you see the child struggle, and then you'll be wondering, but what is the problem? Ada is a girl, she is a girl. You know, as simple as that, this child wouldn't be able to copy it. You know, so that's dysgraphia. There's dyspraxia. That's inability of the child to coordinate movements. There's something we call fine motor skill and gross motor skill. Now, in the early childhood, and mind you, some of these things manifest at the early childhood.
Yes,
and that's why parents should actually be vigilant towards their children. So now, dysgraphia, hand coordination, fine motor skill is your hand, ability to manipulate objects. And you know, at the early childhood, they are doing a lot of things with their hands. They are doing craft, they are learning how to pencil grip, they are learning pre-writing skill, playing with Play-Doh. All those things are to help their fine motor skill. Gross motor skill is the ability to lift your body. You know, you say, I'm hopping, I'm jumping, I'm this and that. So a child that has dyspraxia cannot do that. The child will find it difficult to coordinate, to manipulate objects with the hands. So when the mates are playing with dough, this dough that Play-Doh that you you see that child will not be able to hold it. So how does that affect learning? The child is not because that Play-Doh is to help this your finger, so that when it's time to write, when we say hold your pencil froggy style, the child will be able to hold it. Yeah. So when it comes to that time to hold, the child wouldn't be, because eye and hand coordination isn't working properly. It's a neurodevelopmental disorder, you know. So there's the ADHD. ADHD is the hyperactivity. Now, I tell people, don't go and confuse hyperactivity, because there are some children naturally hyper.
Yeah, true.
So, you know, you don't say, this one has ADHD. No, it's a severe one, where the child can hardly sit down, where the child has to distract other people. It's a terrible, it's a severe form, because this child, even when you flog the child, like some people will resort to flogging, the child cannot help himself or herself. So, and that's where it's even so bad. No control. You just see the child jumping again, trying to make sure that other people are doing same with him and all. So, but it's an issue that can be managed. Then you have dyscalculia. Dyscalculia. I'm just mentioning the 5 most common ones.
Okay.
Dyscalculia is the inability of that child to comprehend basic mathematics basic. I'm not talking of when you are carrying formula without remainder. Oh no,
Those basic 1 plus 1.
Basic 1 plus 1. That child cannot comprehend it. So, and I tell teachers, don't mistake it with phobia of mathematics. You know, some children just have that math phobia. That is different. Dyscalculia is a severe form of not being able to count, not being able to do basic, very basic mathematics operation. You know, so these are common ones. Autism is not fully, you can't call it a full learning disability, but there is a spectrum. You know, autism has spectrum.
Yeah.
So there is spectrum of autism that can be classified as learning disability. And there are lots of others, but I just stop on this 5 because it's the major common one you see in the classroom, you encounter every day. But I will always say, you do not have the right to actually label any child that. Your business is to document what you have noticed over time again. Not that in class, school just resume now. You just start week 1. This child is no.
Okay, now let's look at this. Like, I have a story. There's a particular child in the school. The child is about 3 years old. I met the child early this year around January, and everybody in the class, when it's time for a class activity, the child resorts to sleeping. That's what he wants to do. At that point, it's either sleeping or just staring, open his mouth and stuff like that. He's big. He's the biggest, like, tallest in the class. And then when it's time for food, he's active. Absolutely. But when it's time for reading, writing, you have to literally, okay, at first the teacher was always scolding him, threatening him with cane and stuff. But we saw that it was not working. He's not even threatened by your threats. He's not threatened by your canes. So when it's time for food, that's when he's active. He will eat his food, scrape the whole plate, clean, like he only eats, he uses the toilet. That's what he does. But when it's time for any other activity, he doesn't participate. So the teacher was like, at a point, she now spoke to the owner of the school and told the owner that there's something wrong with this child. That she spoke to somebody about the child and she told that this child might have a particular problem. Now, reaching out to the parents said it's not possible. That all their children have been normal, so this child has to be normal.
Yeah.
So now, in that situation now, they have advised her to take the child to a professional to seek help, but she doesn't want to. And in my own understanding, they keep wasting school fees because the child is not learning anything. The child cannot participate. On assembly ground, every other child is doing every other thing. He's just on the wall, drawing things on the wall with his hand like that. He doesn't do anything, doesn't participate. So now, that challenge of especially African parents, we don't believe in therapy. We don't believe that the next thing, even if they believe there's something wrong with each other, they'll tell you our village people don't attack us, that kind of thing. So now, how do we inform our parents or parents that this thing is possible and they should seek help at the right time? Because if they continue in that way, and for example, it's a school where they can pay their way and keep promoting the child won't learn anything. So how do we fight this?
Okay, see, I was about to get to the point where, you know, I wanted to tell you that parents live in denial.
Okay.
From my experience in the class, because of course I've been in the class, I've been with schools and people that, you know, manage school. And truly, first is that I sympathize or I empathize with parents because you see, learning disability doesn't know any. It doesn't know any race. It cuts across race, socioeconomic status, gender, whatever. You know, so because some people will say, oh, it's a rich man's thing. So when you call people, maybe, sorry, I noticed this, you need to go and say no. Now rich people, they get those kind of things. No, it doesn't. It affects from anybody, you know, and all. So the first thing we need to create is awareness. The other one is we empathize with parents because it could happen to any parent.
True.
Yeah, it could happen to any parents. Then the third one is to be able to get parents to the point where they see this as an issue. Okay, some 4 or 5 years ago, I had a boy who, some of these things you just mentioned now was also manifested in this boy. And the teacher had called me. Now, this has taken over a year. You know, we had tried to manage him the way we can, you know, and all. In fact, because of him, I had to go and get, you know, special education books and all, and, you know, reading and all, just to be sure that you're not trying to just say things that are not existing. So I remember calling the parents, and I told the father, the mother was there too, that I think in fact, on that particular day, I was driving and I heard over the radio where a particular group came all the way from the US. These people are special education experts. An NGO brought them into Nigeria, to Abuja, to Wuse to help, you know, parents whose children and schools that have such children. And what they were doing was free diagnosis, free whatever, everything was to be free. You know, so when I called these parents and told them that I think, I had actually told the mom before, just skeletally, but now I called them as per management with the head teacher. So I think that you need to take this boy for assessment. And because I also had a solution, I said, okay, so I heard over the radio, this, that. I think you should try this. You know, there's no harm in, oh no, the father walked out of the meeting. The man walked out of the meeting. In fact, the wife stayed there out of respect and was telling me, no, I said, I also believe that God can do everything. But I also believe that knowledge, walking from the place of knowledge, is so important. Yeah. Because even God says, my people perish for lack of knowledge. Yeah. You know, so I believe that from the point of knowledge, you can even pray. From the point of knowledge, you can begin to take therapy from the point of knowledge. But you must acknowledge first that you need to take, you know, and everything. Long and short of the story, they changed the child's school. So, because this program is also for behavioral change, parents that are watching us, I would actually enjoy you because even the parents, let me tell you, before a teacher even notices those things, even the parents have noticed. It's also the fact that living in denial. That no, it's not my child.
Exactly.
This, it's not my portion. God forbid. And God forbid has not been a strategy. It's not my portion. It also has not been a strategy. I believe in God. Sincerely, I have faith. But I also tell people that ignorance is not bliss. You know, they say education is expensive. And a wise man said, try ignorance. You know that ignorance is more expensive. So part of what we are doing today is to encourage parents that you take your child. There's nothing to be ashamed of. I've heard of parents who lock up such children in the house.
Yes.
They don't allow them go to school.
Yes.
They don't allow them
to avoid embarrassment.
Yes, that they are being embarrassed. I mean, who does that? Especially parents in this 21st century when knowledge abounds. So it's to enjoin parents that take your child for assessments. And you know, some of these things are better off when they are really small.
Yes.
They begin to tell you what to do. A lot of I read when one of these, the Virgin Nigeria, the owner of Virgin Nigeria, said he was dyslexic as a child. But look at him today. So with good management and all and therapy, and you see your child will blossom, win awards, do everything every other child will do, and even better.
You know, when you're not on the know, there is no way you can actually pass this information. At least someone who knows this is at advantage in able to pass it. Then talk about those people who have no idea of these things. It will be really difficult for them. Now let's talk about the causes. What exactly are the causes of this learning disability or learning disorder?
Okay, the truth is that there's really, scientifically, there's truly no cause for them. Okay. But, you know, it's just like COVID now. What brought COVID? Well, research is still ongoing. Yeah. So it's the same thing with learning disabilities. But they will postulate a few things. You know, they say, okay, fetus, you know, a pregnant woman who was exposed to certain toxins that it could cause some, you know.
So people are born that way?
Yes. Some are congenital. They were born with it, you know. So that it could be from toxins. The mother was exposed to toxins that could lead to that. Some postulations said children who are born with prematurely or born with low birth weight stand the risk of having learning disability. But the truth is, they are actually not known. Research is still ongoing. But you see, you know, when you keep doing research, certain postulations will come out that this could be the possible. It's like the way they say cancer. Nobody really knows, but you know, they will keep telling you dietary, do this, do that. You know, that's the same thing too. You know, there's really no known causes, you know, and they'll say, okay, some say fetal disorder, that probably the mother, smoking, risk factors, that smoking during pregnancy, excessive alcohol, excessive smoking, these are all just what they keep postulating, but there's really no known causes of this. I know a Nigerian parent watching me will say, God forbid. Yeah. It's true, we all say, God forbid, you know.
But it could actually happen to anybody, like you said.
Yes.
Okay, I'm sorry to cut you short at this point. We'll go on a short break.
Okay.
All right, viewers, we'll be going on a short break now. And when we return, Engendered continues. We'll be right back.
Welcome back to the program. If you've just joined us, this is Engendered, and it's coming to you live from our Abuja studios here on Kaftan Television. Before we went on that short break, we've been discussing learning disabilities in children, learning difficulties, learning disorder. I've been doing that with Mrs. Irene. You really said a lot about this topic for today. Now, we want to know the strategy parents should use to avoid this learning disability, strategies teachers should use, strategies elderly ones should use to help these children.
Okay, to avoid, well, like I said, it can just happen to anyone.
Okay.
So maybe like some of the population don't drink excessive drinking when you're pregnant, don't smoke too much, you know, just maybe. But for people who have already, you know, this child has come in, it's a special child. And what do you do? First is, if you have noticed certain things, and like doctors will always tell us, you know, I just had a baby too, an old age one. You know, they tell you that once you notice certain things in your child, come back and tell us this is what. And there's something you call developmental milestones for children. You know, so 0 to 6 months, there's certain things are expected of a child to be doing.
Yeah.
6 months to 12 months, 12 months to 1 year, and all. So I'm not saying every child will develop at the same time, but of course, there are certain milestones, you know, that the parents should look out for. And when you're not seeing it, it's not out of place to go to the hospital to see your doctor and say, okay, this, even if it's a panic, that's thing. Because I know sometimes they say, oh, it's a false alarm, but it's good to go and let the doctor now say, okay, no, this is nothing, you know, and all. So you go and assess if you have noticed certain things, and then don't live in denial. Then talk with the school. And of course, you know, in education now, even in special education, the policy now is that special education should be integrated with the normal education.
Okay.
You know, so because before what we used to have is they have special school for
special people,
for special kids. So now the latest whatever now is that let such children be schooled the way with the other people, so that they are also beginning to, because when you keep just them, it's like you're separating them.
Yeah.
So by the time they are staying with other children, you know, you are also giving them some level of competition, and then you're also creating empathy in these ones too. That, oh, this person is finding it difficult to write. There's something, I will empathize with that person. Okay, you don't understand it. Okay, let me help you. Let me help you hold your hands. So it's a win-win, both for the special children but the caveat is that you must have special education teachers in the school. So you can't just say, okay, because government says that special education should be together with the normal, okay, let the normal classroom teacher. No. You need to have, because there are people who are specialized in special education. That is what they have studied. That's what they have been trained to. And they know how to, you know, work with those children, while the children are also with other children in mainstream school. So it's good for their interaction. It's good for the children in mainstream school. It's just a win-win thing. But make sure there are special education teachers. And then there are also guidelines they give to parents. When your child has certain ADHD, there are certain food they tell you not to actually give your child.
Okay.
Yeah. You know, I'm not a doctor, but I'm just telling you, there are things, so you have to stick to those guidelines. You know, there are certain things you don't give. And naturally, I tell parents, as even I'm just an educator, I have 4 children, and 2 are hyperactive. You know, so I mind the quantity of sugar I give them. So, and even this is putting it out there for parents, because you're sending a child to school to learn. I see parents, there's Ribena, there's every fizzy drink is in their,
yeah.
And this child is so hyper. And then short break time, because we have 2 breaks in school now. Short break time, this person has downed 1 fizzy drink with water. Meanwhile, this is someone that The teacher has been saying, sit down, Junior, sit down, Junior, sit down, Junior. Now he has downed this one. And some of those things are like 500 mil. This one has downed it. I mean, the teacher is in trouble, he's in trouble too. So they start again. Then long break time, by 10:30, you see the child now eat the food, another one. You know, the mother say, no, this one is milk based. Go and look at the quantity of sugar. So even for children that are not even ADHD, you need to look at, you know, sometimes at a point I said, today is no fizzy drink day, no fizzy drink week. Do you know it's still the parents that will come and fight you, not even the children? Well, no, exactly. My child, yes. You know, and I keep telling them, may we not use our money to destroy our children.
Exactly.
You know, so today we say this week is fruit week. You bring garden egg, you bring what? They say no, fruit is expensive. I say no, garden egg is cheap. And then you see some person, hey, how can my child be eating garden egg in the class? And I say, what is wrong with garden egg? So I had even one day my daughter told me, Mommy, I can't be eating garden egg in the class. I said, where did you learn that from? Garden egg is a type of fruit. Take it. The way people are eating apple, you eat it. So, you know, there are so many, I know there are adjustments they give them to do. And I hope the parents are able to, because in doing those adjustments, you can just see your child, you know, you manage that situation better, and your child also learning better. It takes a lot of commitment. It takes a lot. The other thing I see is parents pushing them to lesson teacher. So
extra lessons.
Because my child has this, then just bring lesson teacher. I don't even want to go into that.
It's what they don't know now. What you don't know is bigger than you. So
Exactly.
You just make a wrong decision.
Exactly.
Okay, now you mentioned the fact that some parents actually lock their children up, and I believe that is because of the stigmatization. So now, how do we fight this stigmatization or discrimination in our environment? Because they're trying to seclude them in a way that my neighbor should not see him or her and mock me that I have a child that has this particular problem. So within our environment and amongst us, how do we fight this stigmatization?
Okay, part of it is what we are doing now. And also, I think right now the awareness is high. It's higher than before.
Okay.
Yes, I'm beginning to see support groups. You know, I was talking with my former classmate yesterday, Deep First, and she was telling me, oh, Irene, don't you know my daughter has special needs, you know, and all. And then we began to talk. But because, you know, these days, people talk about these things. Maybe if it was 10 years back, she would not tell me that.
Yeah.
Because I've not even seen her in 23 years or 22 years after secondary school, but because we talk on phone and all. And, you know, so, and I started giving her some things to do. I said, oh, Maureen, do this, do that, do this, you know, check for so and so resources, you know. And then also, because she also has people over there, so you could take her there, you know, to go because they have better system and all. However, I know that there are support groups coming up. That's one. Then two, the best motivation is the one you give yourself.
Yeah.
It's not the one motivational speaker gives you. The best motivation is the one you tell yourself. You know, so you have to tell yourself. Because, okay, now let me even tell you something. Let me shock you. I tell people that we all have some disability in one way or the other.
Actually.
Yeah. It's just that maybe the disability you have is not impairing with the work you do. For instance, I have a disability of not knowing direction. If I go to a place and there's so many doors, when I'm coming back, I will enter the wrong door, In fact, I would have gone like 3 wrong doors, and then maybe I'll now see somewhere where they put alarm. I said, no, I didn't see here when I was coming, you know. So I have that problem. Imagine if my job was dependent on direction. Then it will impair on my work. So it will become a disability because it's impairing with the job I do. So if you look, so every one of us have one thing or the other, you know, and all. So keeping a child and locking a child is not the best. I would actually encourage parents to also look out for materials. Read up on other people. You know, I read on, there was this boy that was, I don't know what he had, maybe autism or something. But the mom, she resigned from her job. She was a doctor, but, you know, you say, okay, they have money. But it's not just about money. It was the commitment. This boy went for Paralympics, won gold. I'm telling you, that was like 10 years ago, 12 years ago. He won gold. His name now is written in gold, you know, And this was a so-called disability and now turned to ability. So I know there are support groups and so on. Parents should look out for it, and schools should also have, the way we do PTA meetings, let's also have, you know, a support group like that. Maybe in your school you have special education department, and then you are getting more students who have such, you know, put in the facility, you know, because there are certain facilities apart from even just this ones I mentioned. Well, not being able to work, personally, it's also it's a disability that could impair learning. If you don't have ramp in your school, so they have to be carrying the child, you know, on staircase. First, is dehumanizing, especially depending on the age of the child. You know, you are killing the child's self-esteem.
Yeah.
So certain facilities need to be in place. And if you're going to mainstream special education into your school, you must have those things. Have a ramp. Make sure you have special education teachers. There are certain equipment they use. Make sure you have them. Create support group for parents. So that they can talk with each other. Once we have support for each other, we know that I'm not alone, you're not alone. So we can share knowledge. So this is my problem. Okay, some people have even gone ahead of you. They say, okay, and then some are just coming. Maybe they're, so we're like, oh, no, just be cooling down. This is what you do. This is what you don't do. And things like that. So these are things we could do. I wanted to advise governments, you know, but I don't know how to advise. No, I've been advising since. But okay, let's advise too. The advice should also be that, you know, government in their own schools as well. Because when you go to their schools, you don't have some of these things. And you have children from the very inner city, you know, disenfranchised, disadvantaged homes. They can't pay school fees for this. Because to tell you the truth, special education is expensive. Terribly expensive. And why is because you don't even have too many special education teachers. And then, of course, the equipment they use. So now let's look at a child, because we said the learning disability occurs to people from different socioeconomic backgrounds. So let's look at the disadvantaged homes, coming from a place where they could barely eat. Then they have a special child. How can they afford that kind of private school? They won't be able to. So, and then the government school do not have the facility. So to advise government is also that there should be in major schools mainstream this as well, so that children from that lower category can also benefit and become something in life out of, you know, the disability they have. It can become ability.
Yeah. Like you said something, everybody has a disability. Remind me of when I was in school studying French. You know, in that department, people there, it's just like, hey, you hear everybody say, I applied this, but they gave me this. I applied this, but they gave me French. I applied this. And most students in that department were suffering. You have to pass.
Yes,
if not, you will waste your money. At least me, I had my own disability. I'm not a language person, but I took time. It took me time. I was slow in learning it. And there were people who, Ma just did this department. Like, is that also like you said, that means that is also a disability?
Oh, well, that's, you might not call it a disability in the sense that it's language. Okay. Anybody could have put in some extra effort to learn, you know, and all. And what might be impeding that learning might not be might not be a disorder that came from the body. It might just be interest.
Yeah.
Lack of interest.
Yeah. And again, you said another thing about mixing up these people. Yeah. I don't know if it's a good idea to me, because then in my secondary school, we had a blind girl. And this blind girl came, it was a federal school, FGGC Buhari. This blind girl came to the school because of the expenses. The parent couldn't afford for the private school. So immediately she came in, she was feeling left out. Like, people just separate themselves from her. She did not feel, she's always feeling, nobody is with me. And truly, nobody was with her. Because if you are with her, you have to stress. You have to take her from one class to another. You have to help her pull. You have to help her do. So everybody run away from it. Like, I don't feel it's really, really
okay, cool. But you see, when I say mainstreaming, it's not me, that is what the policy says now. But you must, for you to mainstream special education into the regular education, is that you must have the facilities available. You must have the support. You must have the resources. You must have the people. You must have, for that girl now, who was in charge of taking her?
Yeah, there was nobody.
They
will just
wrong.
assign you today, it is your turn. You, a student like her.
Okay,
it was really stressful.
I know even if they had assigned students and you students were taught empathy and so on, because part of it is also for, I look at, you see, that in education, there's something we call hidden curriculum. Hidden curriculum is, I have planned this curriculum that I want to teach these children table, you know, and all. But out of teaching them table, they now learn probably leadership. Maybe make this table and all. We want to just have a table. But then they now took charge. Somebody took charge. Okay, put it this way, put it that way. Originally, I didn't intend to teach them leadership. But from what they were doing, leadership came out. So, even in mainstreaming, part of the hidden curriculum would be to teach those children empathy. Because it could just be their brother, it could be their sister. As long as taking her out does not affect their own classes, I mean, there is no big deal in it. Because suppose it was your sister that had that, or your brother. Would you leave your brother or your sister that way? Yeah. But you see, the knowledge, the awareness, I'm sure you're talking about 10 years ago or something.
Yeah.
But awareness then and now is actually totally different and all. And part of what I try to, you see, learning covers domains. And you see, unfortunately, schools are always looking at the cognitive, which is what has to do with the brain. The affective, you know, and the psychomotor, but mostly the affective, which has to do with emotion, empathy, is the part we don't look at. We don't focus on empathy. Because if we focus on empathy, there are so many things in school. You know, you can't raise people who are so intelligent and wicked. So he's a medical doctor, but he knows his job. But he's so wicked. Is that not a recipe for disaster?
It is, and they forget empathy. True.
It's out there.
Just as long as you get the grades, you can move on.
Exactly. And you see that again, as long as you get the grades. You see, again, I tell people that learning is actually a process and a product.
Yeah.
The product of learning will be that certificate you have. But the process itself is what you went through to achieve that. You know, so the process is as important as the product. So if you say this person is a medical doctor, first class and all, a first class engineer, but he's terrible, wicked, he doesn't have empathy for his patients, then it's also a faulty process. Because the process has to be as good as the product. So I cannot be coming, and that's a part of the defaultive education we have, where somebody will present a first class and cannot write an application. Somebody will have A1 in WAEC and cannot actually speak English.
They can't practice.
So we focus on the product and we are not emphasizing on the process, because it's both a process and a product.
Okay, you mentioned something earlier that I want to go back to, and I know it has been a topic of debate for a lot of people. You mentioned that you don't understand the fact that where some parents put their children and then with a cane beside them to learn. Are you an advocate for using, the Bible says, spare the rod and spoil the child. So should we use a cane? Like there are some schools that you go to and the parents will tell you, I don't want you to ever flog my child. And some people are saying that's the reason why we have so many children that are misbehaving. So what's your thoughts on that? Are you an advocate for spanking the children or don't spank the children?
Before you answer, ma'am, the school I went to, FGC Buhari, they don't allow flogging. It has nothing to do with any parent. It's just a rule that they said you can't flog any parent. If you offend or you go against any of the rule, they just punish you. And I see some people, like me, you can't flog me. Like, I'm not used to cane. It does not even work for me. It threatens me, but I don't know how I feel if I get flogged because I'm not used to it.
Okay, so when people say spare the rod, what is really the rod? They need to go and research what the rod was, you know, as put in the Bible. Now, correction. I think spanking a child is because you want to correct, isn't it?
Yeah.
What is really correction? Because inflicting pain, physical pain, might not necessarily mean correction. You know, because if you think cane means correction, before people became armed robbers, they were petty thieves. They were flogged. Did it bring correction in them? So you need to look at correction holistically. Even in correction, you need to ask yourself, what do you want to achieve? Do I want to dehumanize the person? Do I want the person to... Because correction should bring behavioral change. Do I want a behavioral change? Or I want to reduce that person's self-esteem? Or it is my own inability to control myself? So when I told you that we see mothers holding cane, First is that most times they don't even know what you're doing, because you are causing educational trauma. What they call educational trauma. Now, when a child, because you see the brain is complex. The brain processes what is happening. So this child is going to be associating learning with pain. It's like, I have my baby now, they're trying to make her hair and she's crying. Now, when they come close to her, just to do it, she has started. Because she has associated making hair with pain. And I've told them, leave the hair alone. Leave it alone. Because already this child is just going to be 1 year. Now we are programming her in such a way that when hand comes this way, in her brain triggers pain. Pain has not even started. That is the same way when you have cane, you're teaching the child. This child is associating learning with pain. But learning is supposed to be fun. Learning is supposed to be enjoyable. And that is why we have the kind of learners we have. So the child associates it with pain. When they read to pass the exam, they throw the book away. So we are not raising lifelong learners. We're not raising learners that will just read for pleasure. Take a book and just read for pleasure. I tell myself that one of my philosophy for teaching is learning is fun. Learning, any child can learn. And I want to raise children who love to learn. So I have 4 children. One of my daughters doesn't really like cognitive things, doesn't really like school. But she reads for pleasure. Because I have understood her. So now she just picks books and she's reading on her own. But now she doesn't associate. If I had used cane, she would associate reading with pain. And then she would only read to pass exam because she also doesn't want you to flog her again. Then any other reading, and can I tell you something? The reading you do for your life right now is different from the reading of what they taught you. So you need to keep reading. You need to know what we call lifelong learning. If I've associated learning with pain, I won't be a lifelong learner. And that's why you see, check the number of people who transit from BSc to MSc, from bachelor's to master's. How many? From master's to PhD. Because the reading was made in such a way that they brought you out on the assembly, lash him 24. And they're 24. So school, pain. Let me just manage. And because it was our parents basically that paid for bachelor's, let me manage and graduate. So the one I'm supposed to pay for, which is master's, Shebi is me. I cannot go and kill myself and die again. I'm not going. So you see, if we need to do, so people were traumatized, quote and unquote, in the name of learning. And you see them, it's a carryover thing. And you see the parents, because they are still traumatized, that is why they are still caning the child. And they are carrying over trauma. Some parents, I was telling an adult recently, I said, you're still living in trauma. Yeah. I said, you're living in trauma that your parents inflicted in you. Because he was telling me how the parents used to lash him, look at wounds all over his body. They use wires, electric wire, to wipe and everything. I said, you're living in trauma, and that trauma is still in you, and it's manifesting in the way you want to think, you want to treat your children. So a lot of adults are traumatized. And like somebody used to say, did we really turn out well? Because you see, it's not about flogging and then there's fear, but there's no behavioral change. I'm only because of fear. Let me do it and pass. But there's nothing that changed in my behavior. When I leave that environment, I leave you, I go and do what I want to do. Then correction wasn't achieved. So I am not, when you say spare the rod, ask me what is really the rod. There are discipline, and you see, when you, okay, I don't know if you have read the stories of some teachers that flogged children and children died.
Yeah.
I don't even know how that parents will forgive.
A lot of injuries on them.
How would that parents forgive the teachers? The teachers are coming from traumatized background. And then they are carrying cane. Yes, people will say maybe that's why we have learners that are what now and all those kind of English they use. And I've asked them, bring the statistics between the one they taught us and these ones. What we need teachers who are trained. We need teachers who are teaching for the love of teaching, not teachers whom there was no job, they say go and manage teaching. Yes, we need teachers who are trained. We need teachers, then we need, remuneration package to be good. those are motivations and so on. Those are the things. So that if a teacher, we're not looking for the worst people to come into teaching because there's no job. The banks, oil companies are taking 212, so all the ones that are left. They say, okay, just go and teach now. And then the person carries the frustration of, I'm supposed to be in the TV. I'm here with children, and begin to flog. So we need teachers who are trained. We need a working system. We need to reorient even the parents themselves. The parents have adverse childhood effect that's still worrying them. You know, a lot of parents are still traumatized. That's why here, if I treat you the way my father treated me.
Exactly.
What is that? If I treat you the way my father treated me, I'm telling you, if I beat you the way my mother. So, and when your father was treating you that way, you were sad, you were angry, you were bitter. So if you were having all those emotions, why will you now be telling your child, if I treat you the way? So you want your child to go through that circle of bitterness, anger, and everything. There was a child that recently, that the father died, and he wrote obituary about the dad, and he wrote, people were wondering, and he was thanking God that the father died, and recalled the pains. So this person is an adult, maybe 40-something, 50-something years, and yet has not gotten over the pains of what the parents inflicted on him.
That's really a sad one. I think, I think I will just stick to what you have said. The fact that the teachers should be selected.
Yeah,
teachers should
it's
not
not
just,
everyone that can
it's
teach.
not everybody. I don't have that patience. I have that disability.
I'm talking to you. I don't really teach early years.
Okay.
Because I'm not so I can design things for them, because you must know your area of strength when it comes to teaching.
Yeah.
I can design things, this what children can use, this, and then I step aside. I can even come there and put on all those their dancing things for them. But you see too, I don't have that spectrum of patience.
Same here.
But I can teach primary school. I do that. Primary 1, 2, 3, 4, 5 and all. So you must know your area of strength.
Exactly.
It's not everyone that can teach.
Exactly.
And don't deceive yourself and say, okay, I just take it, let it manage. No. Teaching is not what you manage.
Exactly.
Because when that anger wells up in you, you won't even know when you have started, flogging and
them.
all. And you see people have even associated teaching with frustration.
That's a topic for another day. Seriously. So literally, we always have to be patient. Parents that have children that have special needs, please be patient. Don't be ashamed. Take care of them properly. It's not something for you to start thinking about. I guess I rightly said the ignorance is more expensive. Yeah. Not something for you to start being shy about, or start feeling like your village people are after you or something has happened to you. Go and seek help. And I don't know how the government can help us to subsidize this fee, because it's really expensive. The fact that we have to get teachers, qualified teachers that will take care of children with special needs, it requires a lot of patience. It requires a lot of funds because they require different materials from the normal children. They require different textbooks, different audio devices and stuff like that. So it's something that we really need to invest in, and a lot of intervention needs to be done about this. But for now, please, teachers, don't be frustrated. Be patient. If you're not patient, please don't be a teacher. Don't put pressure or throw your frustration on somebody's child, please, I beg you. And that's all we can take on today's episode of Engendered on Captain TV. Do well to join us next time for an interesting episode. I remain Chidima Ufomado.
You passing out knowledge, teachers, parents, whoever you are, don't attach passing your knowledge with pain or fear, like our guest have said. I am Pamela Ajero. Bye.
Bye.